Hi, welcome to today's health segment on the Breakfast Show. I am Dr. Nakbienam Fire. So this week we have been talking about diabetes, and we have discussed so many things about diabetes. Just to talk about some of the things that we have highlighted this week is that diabetes is a condition where there is elevated blood sugar in the body. And this comes about because your pancreas might not be producing enough insulin, which helps to take up the glucose from your blood, or your muscles are not, or your cells are not taking up the insulin or the glucose from your blood. And so you end up having an elevated or high blood sugar. We also talked about the signs and symptoms. We say that people with diabetes usually present with eating more than they usually do, drinking so much water, and also urinating frequently more than they usually go to the toilets to urinate. The other thing that we talked about is that diabetes has medications that are given to treat the condition, and you need to take these medications almost your entire life, and you have to be consistently taking them to prevent yourself from having complications of diabetes. We also say that you need to have a proper diet that you should be following to prevent you from having elevated blood sugars. You also need to be physically active every day. So yesterday we talked about the complications of diabetes, and we say that diabetes can affect many organs in the body, including your heart, your brain, your kidneys, even your eyes and your nerves. So be sure to take your medications and prevent yourself from having complications of diabetes, because they can be so deadly, and they can even cause death if not treated or managed well. So today we'll talk about how you can prevent yourself from having diabetes. First, I would like to mention that there are many risk factors for diabetes, and some of the risk factors include your weight, that is obesity. So if you are obese, you are more likely to have diabetes. Things like your diet causes risk on you having diabetes. So if you eat a lot of sugary things and you are not eating foods that have more fiber, foods that have a lot of nutrition and protein, then you are more likely to also have diabetes. If you are not being active, you're not exercising, you are mostly seated, whether it's at work or at home, you are also increasing your chances or your risk of having diabetes. The other risk factors include smoking. So if you smoke, you are increasing your chances of having diabetes. And also alcohol intake. So if you take alcohol, you are also at risk of having diabetes. So how you can prevent yourself from having diabetes is by having a healthy lifestyle. So by that we mean you need to be eating healthy, you need to be exercising. So when we say eating healthy, you need to eat foods that have a lot of fiber, you need to eat foods that are nutritious, foods that have protein, to prevent yourself from having diabetes. So you need to eat foods that are good for your body, and not eating junk food and eating foods that have a lot of fat. So this will help to prevent diabetes. The other thing that you can do to prevent diabetes is by exercising. So when you exercise, your muscles are active, your cells are active, and so they take up more glucose. That way your body is not having elevated amounts of glucose for a prolonged period of time, because over time, when there's too much glucose in your blood, it means your cells will become insensitive to the glucose, and so you end up having insulin resistance. So it's important that you exercise. The other thing you can do to prevent diabetes is to stop smoking. Smoking is a risk factor for so many diseases. So if you can be able to stop smoking, that would be beneficial for your health. it will not only prevent you from having diabetes, but so many other conditions as well, like hypertension, heart diseases, lung diseases, liver diseases. So be sure to reach out to somebody that can help you to stop smoking if you are a smoker. The other thing that you can do is to limit your alcohol intake. If you take too much alcohol, you are at risk of having diabetes and also other complications, including liver conditions, heart diseases. So it's important that you limit how much alcohol you're taking. And if you're able to stop taking alcohol, then that would be even better for you. So these are some of the ways that you can prevent yourself from having diabetes. If you are somebody that is overweight and you have more weight, or you are obese, then you need to be exercising to lose some weight. So there's a difference between exercising to just keep healthy and exercising to lose weight. You need to be able to, if you're obese, you need to lose some weight. If you're not obese, you still need to exercise. Even if you're not overweight, you still need to exercise and keep healthy and prevent yourself from having not only diabetes, but even so many other diseases as well. So this has been the talk for this week. We have talked about diabetes and how you can prevent it and how it's managed and how you can manage your diabetes even while you're at home. So thank you so much for watching this week's show. I do hope you have learned something, and make sure that you go to the clinic to check your blood sugars. Even if you're not yet diabetic, you need to be able to go to the clinic and check your blood sugar on a regular basis so that you can know that how much sugar you have and you know that you are not diabetic. So stay healthy and stay well. Make sure that you eat healthy and make sure that you exercise. Thank you for watching.